lower lobe consolidation, the lower lobe is near the liver, right? So liver is white, right? Because it is dense. And you have got now the consolidation of the lower lobe so that there is no air. It is filled with fluid, mucus, this, whatever it is filled. But in short, there is no air. So there is consolidation. Now both the densities, they are same, right? So the example which was given, well, that example was more or less like, I mean, sorry for using this word, but it was more or less like showbaj. Okay, this is what it is done. If you really tell something which is really amazing, and that is like that these AI, they can identify. It was done for the first time. They identify that there is a difference in the pattern of retina between male and female. Now that is something which is amazing. Now, if you really talk about say as such, since years, since decades, right from the very beginning, when all those communities started developing. But as such, if you see human beings, they are all disconnected. We are pretty disconnected. So previously, if you really wanted to, I mean, even when you were not born, even when I was not born, way back, right? So way back. So at that time, what was the thing? They used to write those postcards, right? Those postcards without worrying about care. Postcard mein, as such, if you know, don't worry, Tanvi, about the bronchiectasis. Wait, let me put it so me. Let's just a minute. Let me put it on another screen. It becomes easy for me. Yo. Robots can replace human experience. I will talk about this. Bronchiectasis, Tanvi, don't worry. Don't worry. And yes, Samita, you can record. So what I was talking about, that humans, they were a bit disconnected. Fast forward now, if you see, that we are quite connected. But as such, if you see, AI entered into our life the day internet came, right? The day internet came, because internet was like explosion of information. Now, when in 2000, when the Google came, so Google was like, you today also you search for Google. I mean, you search anything, you search the causes of headache on Google, you'll find that there will be 2.7 million articles, right? Which article to select? We don't know that. So it is like a random thing. That's why people are going mad for SEO, search engine optimization. So it's like, if I am the radiologist, I want to put my ad, my website is there. So yes, I want to come on the top. And that's where so many scams are going on. So many scams. It is recently in Ahmedabad, one of the gynec, he was scammed by 17 lakh rupees. Reason? Now you must have noticed that people, even doctors, hospitals, they start advertising, right, on radio and everything everywhere. So they create a website, and their intention is, "Nahin, my site should be on the top." That is what is called as the search engine optimization. That is, if you are on the second or third or fourth page, then chances are very trim that someone would really watch you, right? Because we don't have the habit of going on further unless and until we are very specific. And you dive deep into what is called as the deep web. Deep web, that is when you don't use these browsers, right? You don't have to use these browsers. You can't even use these browsers like Edge or Chrome or this Safari. No, that is where the onion is used, right? It is Tor. So that is a very, very different level. But over there is nothing like search engine optimization, because people know that where exactly do they want to go, what exactly they really want to search for it. The entire world is totally different, and it is like an iceberg. What internet people are experiencing in the form of www, that is about one fourth. Oh, sorry, it is just 4%. One fourth, it is 4%. 1/25th part of what is deep inside. In deep inside, if someone tells about that, okay, this is what really happened, you go to deep web and search over there. But no doubt that word itself is extremely dangerous. Like, you just can't go straight away. It is like a war. War is going on, and you say, "Nahi, main to t-shirt or jeans pehn ke nikal jaun," and then bullet would fire you. Same thing happens over here. You have to really protect yourself very properly by creating what is called as the VMs, so virtual machines. And in virtual machine, there is another virtual MAC address. MAC address is like your signature. Right now you are connected, right? Say for example, Tanmay Pawar. The moment I run my software over, I won't be taking name of those softwares, but if I run that, I'll be able to pinpoint you that you are connected from which location, what is your IP address, what is your MAC address, so much so that I can even know that by on which device are you. That is, if you are on let's say, I'm giving the example, if you're on laptop, though, I'll be able to figure out that it is a Lenovo laptop and what is the CPU identification. So that way, all I have to do is you purchase the Lenovo laptop, right? And in case if you commit any crime, so then that MAC address, because MAC address is like your signature, right? It is fixed. It can never be changed unless you go for this VM, virtual MAC address. But it is a complicated process. But this Lenovo, I can figure out that I can even come to know about your address or your current location. Where exactly are you? Right? We'll discuss even this thing because I feel like that this is important for you to know all these things. Achha. So this is what really, so that's why when you go to deep web, deep web is a place of gundas. People are there. And for every purpose, things are over there. So that's where you have to really protect yourself very properly that no one identifies you. Okay. And wait, what did you say? I'll show you that. Means we can't do this thing in public, but okay, I'll show you. How do operators look in hospital by operating me? Yes, we'll come to that. We'll come to that. Deep web, dark web, almost the same. Almost the same. But the dark web is the bad part of the deep web. Deep web is like so many things they are done, but in dark web, I won't feel like speaking it, but just giving one example. There was one incident, and people do pay for it. They do watch that, in which a girl was burnt alive. And as she was running, the entire thing was broadcasted only onto that closed group, and people were paying money for that. That is the dark web. Dark web
Sir,
is a
I
place.
guess it's red room,
Huh?
red room, something
Pardon?
like that. Like,
Which
sir,
one?
they broadcast on the red room.
Matlab they see, the people are perverts. There are people who are perverts. They go for anything and everything. And then they have got so much of money, so they don't mind going for it.
Yes,
So,
sir. Actually, it was invented by Navy SEAL, I guess.
no. Navy SEALs,
Uh,
so they are
USA Navy SEAL.
Navy SEAls, so they are totally different. This what I'm talking about, it was not at all. Navy SEALs actually they won't do that.
No, sir. Like they invented this thing for their purpose,
What dark
so
web?
that the conversation is hidden.
Are nahi dost. Dark web is what? Dark web was never invented by Navy SEAL. In fact, the internet, the beginning of the internet was like internet internal networks. It was only for the educational purpose. It developed in US. Then it went to Australia. Then they started interconnecting it. This area, which is hidden, which is like underneath, it was not. It is like Navy SEALs or any of these organizations. They use it. They use
Yeah.
it. Right? So it is like even our intelligence services, they also use it because that is the place where, I mean, females are here, so that's why I can't use some words, but that is the place where nothing is hidden.
Sir,
It
even
is,
human trafficking is available over there.
oh, that is a very small thing you're talking about. There is so much that we need not even talk about it. But that is
Yes.
a place. It is like a double-edged sword. So there are good things, there are bad things, but you get everything. You get everything.
Yes.
And the currency which works over there, that is crypto, right? They don't
Crypto,
use
bitcoins
dollar
and all.
or anything. So everything is based on those 128-bit addresses. That's how it really goes. Anyway, so what I was talking about is that AI is say previously, so we all were disconnected. Now with the advent of this technology, when the Google came, so it gave the information. Then came the ELIZA, right? Way back, right? That must be the time when you all were born, right? Somewhere around about 2005, 2006. ELIZA was ELIZA. Now, ELIZA, they say that it was the beginning of AI, but actually not. ELIZA was like if then statement, right? It was like if then statement. So if you ask for that, I have got headache, so then give this piece of information. So that was like if then statement. Bitcoin is right. Bitcoin was as a Japanese thing. Originally, it's Japanese. So what I was talking about, that is a cryptocurrency. That cryptography itself means encryption. And say there is in Bitcoin also there is SegWit. SegWit means at every definite 2 years and 3 months and 11 days, the value will automatically be double because the complexity of the formation of that Bitcoin, it becomes double, right? So that's the reason that today the Bitcoin is soaring at 1,15,000 USD. The second coin, but is Ethereum, that is at $4,400, plus or minus, right? This is yesterday's rate, plus or minus few dollars. It keeps on fluctuating. But yes, there was a time when Bitcoin was available at the cost of $2, 2008, right? It was at the cost of about $600 in somewhere around about 2016. So yes, if someone has invested X amount, then that amount will become 100 times minimum in 5 years, 100 times. But will it increase? Yet it will increase. But say when the Trump said that, yes, I want to make USA the crypto country. And then the Bitcoin sold from $82,000 to straight away it hit the all-time high mark of $1,24,000. After that, it is come a bit down, but it keep on fluctuating. Technically speaking, say this is what is called as the SegWit calculations. Anyway, so in case of AI, now the AI which has reached, it has become interactive, right? It has become interactive. So what we really say is that basically AI won't replace the human beings. It won't replace. But yes, someone who is knowing AI can replace you. You won't lose the job because you are not knowing AI, but you will definitely lose the job when someone of your level, but he is knowing or she is knowing AI. That's the reason. And AI is not ChatGPT. Right? AI is not restricted to ChatGPT because people use ChatGPT like Google. Previously, people used to go Google everything. Now they go to ChatGPT and they keep on asking the questions. No, things are very different because that using it like Google is not even 0.001%. This is what I was thinking of planning. That is how you can use the ChatGPT in your day-to-day life. Day-to-day life. Say, for example, if you by the way, how many of you have done that homework, writing a love letter to yourself? How many of you have done that? I got just 4 emails. I was just 4 emails and 1, 2, 3. Surprisingly, all are starting with this. Swapna, Sakshi, Sanyukta, Sanya. Okay, Prachi. Now the alphabets have changed. 1, 2, 3, 4, 5. Quite less. Quite less. I mean, 7, 8. We are over here more than 125. And because it is taking so much time, so not more than 10, 12 people have written it. Why? So if I'm telling you something, it is with a purpose. It is with a purpose. So chalo, let's put a number 20. 20 लोगों ने लिखा है. Let's take it a round figure. 20 लोगों ने लिखा है. So then what about 100? Rest of the 100. If it is said, if something is said to you, so then that is with a purpose. And this is the thing. Anything which is given free, it doesn't have that value. That's what really happens. ask those who have written that letter to themselves. They'll be knowing so many good things about themselves. And this is the trouble. Seriously, मतलब यदि VC की गाली बोल के ना कुछ बोलो ना तो उसकी इफेक्ट आती है. Means it is like you have got so much of potential, but पता ही नहीं होता. And then we feel like नहीं यार मैं एग्जाम में फेल हो गया. अभी देखा रिजल्ट FNG का, द रिजल्ट इज 16%. 16%. 84 पीपल, 100 में से 84 लोग साफ. क्यों? अब वर दे फूल्स, वर दे स्टूपिड? पता नहीं था कि पढ़ाई करनी है? नो, दे वर नोइंग इट. बट द ट्रबल इज कि पता ही नहीं होता कि व्हाट इज देयर इनटू माय माइंड. एंड फिर दूसरों को देते. बाय द वे, जस्ट लेट मी आस्क अ blunt question. How many of you feel that money gives you happiness? Money gives you happiness.
Yes, sir.
हाँ, पैसा आ गया तो सब कुछ आ गया. Feel so?
Not everything, sir.
Not everything. हाँ, right. Definitely. I mean, you know what happens? You feel like कि बॉस मैं मर्सिडीज खरीद ली. ठीक है. The day Mercedes comes now, ask yourself, 2 दिन 4 दिन सबके सामने शो मारा क्या मर्सिडीज मर्सिडीज, आपने देखा मर्सिडीज. द डे समवन कम्स अप विद अ बेटर मॉडल, आपकी खुशी गई, खत्म. अरे यार, यस गॉट बेटर देन माइंड. सोचो ना, जब नया फोन लिया तब क्या था? व्हाट वाज द थिंग? है ना? नया फोन, आज स्टाइल मारने के वो अपना आईफोन 11. हाँ, बड़ी खुशी खुशी. राइट. जरूरत ना हो तो भी देन गुड गुड फीमेल्स आर देयर, तो जानबूझ के फोन निकाल के चेक किया, यार देख तो सही कि मेरा आईफोन 11 है. आईफोन 12 आया, वैल्यू खत्म. 13 14 तो बिल्कुल ही खत्म. अब तो फिर फोन छुपा के रखते कि कोई बोले कि साले इतना पुराना फोन यूज कर रहा है. तब लाख रुपए में फोन लिया, खुशी खत्म. कितनी खुशी. ट्रू. सेम थिंग हैपेंस विद एवरीथिंग. Unable to write it. ठीक है, आई एम नॉट ब्लेमिंग अफसर, दैट्स ओके, बट लिखना टू अ लिमिट ओनली. ओके, समृद्धि. ठीक है. हाँ, सो मनी, मनी जो है. हैप्पी बर्थडे पायल. थैंक्स फॉर राइटिंग. विश यू अ वेरी हैप्पी बर्थडे. सो द थिंग इज व्हेन वी से दैट कैन मनी गिव यू हैप्पीनेस, बिकॉज हैप्पीनेस अगर जो याद करो तो वी डिवाइडेड इट इनटू 2 parts. वन इज द डोपामिन इफेक्ट. डोपामिन इफेक्ट इज इमीडिएट इफेक्ट. चॉकलेट खाई, मजा आया. बस आफ्टर ईटिंग दैट चॉकलेट, दैट खुशी इज गॉन. इट इज द डोपामिन इफेक्ट, एंड दैट इज एडिक्टिव. दैट इज एडिक्टिव. अब ये फोन मुझे आईफोन 12 नहीं चाहिए. बॉस, तू आईफोन 15 या 16 लेके कौन सा ऐसा बड़ा तीर मारने वाला है? नहीं, लेना तो नया ही फोन है. आई नो मेनी ऑफ द, नहीं नहीं चाहिए, पुराना नहीं, बस मुझे तो नया लेटेस्ट, दैट ऑल्सो विद 1 TB ऑफ स्पेस. व्हाट द हेल, फोटो भरने के लिए 1 TB स्पेस वाला चाहिए? हाँ, बट पीपल डू दैट. पीपल डू दैट. राइट. सो the point is that all these things are very temporary. But if I ask the question in other way around, how many of you feel यार पैसा तो चाहिए, ज्यादा चाहिए, है ना? So on one side we say that money can't bring happiness. अब देखो, पैसा चाहिए तो उसके लिए तो कितने सारे हाथ खड़े हो गए. So what are we doing? Both the things, right? So there is a difference. The difference is like that money, it gives you those things which are considered as utility. If you are using, I don't say no to that. If you are buying iPhone, buy it, but then घिस डालो उस फोन को, destroy it. मतलब use even smallest function of it. आपने तो यार आईफोन तो, not blaming anyone particularly, but I've seen, I mean, गाड़ी से उतर रहे हैं, बढ़िया सा फोन, एंड when we say कि चलो लेट मी ट्रांसफर सम ऑफ द फोटोग्राफ, हाँ व्हाट्सएप पे भेजो ना. व्हाट नॉनसेंस. ला आईफोन है, देयर आर वंडरफुल फीचर्स. स्ट्रेट अवे जस्ट टैप एंड दे आर कनेक्टेड, एंड देन स्ट्रेट अवे यू कैन सेंड इट, राइट? People don't know even such basic functions. So forget about के home kit or कैसे automation and then using the shortcuts or what it can really do and what is Apple intelligence. नहीं, कुछ नहीं. No. That phone is simply for call करने के लिए, message, WhatsApp या फिर एक दो फालतू ऐप और गेम खेलने के लिए. तो क्यों भाई, क्यों इतने पैसे खर्च रहे हो? But it really happens. It really happens. So the point is that money is important, but AI is not a threat. AI is what we have to really understand it and we have to adapt it. It is developing. Say if I give you this, that two options. First, पहली तारीख से शुरू करेंगे, 21 तारीख तक ले जाएंगे, 21 days. ठीक? You got two options. One, straight away, पहली तारीख को you take 10 lakhs from me. 10 लाख रुपए सिंगल शॉट, या पहली तारीख को 1 रुपया लोगे, 1 rupee. नेक्स्ट डे विल डबल इट, 2 rupee. उसके बाद 4 रुपया, 8 रुपया, 12 रुपया, right? That way. Which option would you pick, first or second?
First one.
Second.
Second.
Okay, so it will be, it's like some said second, some said first. Even if you take the first option, by the end of 20th day, right, it will be reaching to 1 lakh, 10 lakh rupees. But on the 21st day, it will become double. It will become 20 lakh. It will become 2 million. This is the power of binary when things multiply. Why giving this example? Because AI is progressing so fast. This is usually I tell to my technical students. He is developing so fast that it is doubling its capacity. That is what is called as the computation and the algorithmic skills. It is getting doubled every 3 months. If it is doubling every 3 months, 3 months, 3 months, 3 months, 3 months, that is by the end of 1 year, it will become 16 times, right? 2 to 4 to 8 to 16 times. And then if you take it for 5 years, in 5 years, it will become 1 million times, 10 lakh guna, multiplied. It will be multiplied by, it will be 1 million times powerful. By the time you will be completing your MBBS or slightly just before that, this would be the power. So agar jo yahan nahi seekhe, to do you really think when it will become so powerful, you will start learning at that point? No. People would be much more ahead as compared to you. And that's the point when you might be replaced. So किसी ने जो मेल भेजी थी, बहुत सही मेल भेजी थी कि we don't want only medicine, but we want even these things also from you. Sure, I don't mind. But मुझे बुरा क्या लगता है, जब बुरा लगता है तो I say it point blank on face. मैंने आपकी मेल पढ़ी, उसका शायद मैंने रिप्लाई नहीं दिया था. When I said write a love letter to you, तो कैसी कैसी मेल भेजी है कि सर अपने आप को तो कैसे लिख सकते हैं. बस अगर तू अपने आप को नहीं लिख सकता तो तुझे कौन लिखेगा? If you can't appreciate yourself, तो who else would appreciate? Right? कुछ नहीं हो सकता. That's why if I'm telling you anything, तो either it is from my own experience या फिर मैंने इस पे जो काम किया हो वही चीज बोलेंगे, इधर उधर की बात नहीं होगी. And I really insist and I really expect that अगर जो काम कर रहे हैं, if I'm telling you something, तो you follow it. You follow it. Right? Many times it is difficult. हाँ, that's okay. मतलब अगर जो सोचना भी शुरू किया, then also I'm happy with it. Even if you started thinking about yourself, that this is what I want to write, I'm happy. That's okay. At least you took a step. So अब इसमें फिटनेस की बात करेंगे जब, right? तो पूरा सारा समझाऊंगा. And then if I find that okay, 5 people started exercising, so then what's the point? What's the point? And this is what really happens कि बाहर जब पढ़ने जाते हैं 25 लाख 30 लाख फीस दिया, पर वहां जाके मस्ती करते हैं, घूमते हैं. क्यों? क्यों? लैक ऑफ डिसिप्लिन. मैं आपको बोलूं ना कि एक काम करना, आज से रोज सुबह इन द मॉर्निंग व्हेन यू वेक अप ना, 1 गिलास पानी गरम करके पीना है. ज्यादा गरम नहीं, थोड़ा सा माइक्रो कर लिया, 15 सेकंड. You'll find that अंडर 10 days ये नियम टूट जाएगा. देयर वुड बी वन डे व्हेन यू विल फील के आज नहीं, कल कल कल. व्हेन वी सी कि यार इसने इतना किया, नो. ब्रूसली याद करना. ब्रूसली, व्हाट आई सेड, आई एम नॉट अफ्रेड ऑफ अ पर्सन हु कैन किक 1,000 times in a different way. But I'm very afraid of a person who has practiced one kick 1,000 times. That's the point of discipline. That's the point of discipline. We keep on watching all sorts of movies, but no, when it comes to, when I said the 36th chamber of Shaolin, I must have seen more than 100 times. Seriously, 100 times. There are only a few movies. मतलब मैं तो बिंदास बोलता हूँ, yes, why not? मतलब 50 Shades of Grey अभी recently देखा, और कितनी बार, 10वीं या 11वीं बार देखा, because there is some amazing artistic thing. And yes, it is also needed for your brain to function properly. So all the movies, they are with a different temperament, different mood, and that is what is needed. दिमाग है ना आपका, मतलब जब, so this is like that AI is not a threat, and this is for the toxic people, right? पता है वो जो लास्ट मेल जिसने भेजी, मैं इसके लिए बात कर रहा हूँ. बॉस, तू डंपिंग ग्राउंड नहीं है, इतना समझ ले. यू आर अ गार्डन. बच्चा, डंपिंग ग्राउंड इज के वहां पे आके सारे अपना कचरा फेंकते हैं, राइट? तो इफ समवन इज थ्रोइंग गार्बेज ऑन यू, एक बात बता, तूने पूरा घर मस्त साफ किया, राइट? तू पूरा दिन लगाते रही, घर साफ किया एकदम बढ़िया, एवरीथिंग स्मेलिंग गुड, वंडरफुल, एंड देन कोई इडियट आके कीचड़ वाले शूज से उसमें चलना शुरू किया. विल यू से हाँ 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 दैट्स ओके? विल यू फील गिल्टी फॉर दैट? मतलब लड़कियां इसलिए गाली नहीं बोल सकते. when I say kick out such toxic people, तो then it is necessary. लात मार के भगाओ. You don't understand what is called as gaslighting, and even for males, मतलब जो males, दो email जो males की थी, was female can also gaslight you. When they say कि अरे मेरा तेरे सिवाय कोई नहीं है. ये एग्जाम्पल नहीं पता, एक लड़की ने 17 आईफोन इकट्ठे किए, 17 आईफोन, ऑल 17 गिफ्टेड बाय द बॉयफ्रेंड एट द सेम टाइम. आर्ट है ना, कला है उसकी. हाँ, सही में, नॉट जोकिंग. 17 आईफोन, एंड देन शी इज पोस्टिंग ऑन इंस्टाग्राम, ऐसा थप्पा करके दे 17 आईफोन ले. नाउ इमेजिन हर लेवल ऑफ इंटेलिजेंस. बोलो या क्या बोलो?
New startup idea, sir.
but Uday, you need to save yourself from such people. So
Yes, sir.
so the thing is, see, males as well as females, right? Their brains, they are designed. By the way, I don't know if you have noticed or not. Men are from Mars, women are from Venus. एक वीक से मैंने डाल दिया है उसके अंदर. If anyone is, मतलब देखा किसी ने कि नहीं देखा?
Yes, yes.
You saw that?
देखा सर.
Yes, sir.
हाँ, ठीक. हाँ, तो पढ़ लेना, पढ़ ले. मतलब I respect females, but yes, at the same time you need to protect yourself from female के चूना ना लगा जाए. Giving respect, there is no problem, but there has to be an emotional boundary. Emotional boundary. कि बस इस लाइन को तू क्रॉस नहीं कर सकते. That is like a reserved space, right? ये बहुत ध्यान रखना. Because otherwise, जिंदगी में, मतलब आई एम टेलिंग यू, आई वाज चीटेड इन द रेंज ऑफ क्रोर्स. मतलब वो क्या, अपने अच्छे दोस्त यार अपने यहाँ खाना खाते हैं, वो दोनों खाना खाते थे, यार ये तो मेरा बड़ा अच्छा दोस्त है, ये तो मेरा बड़ा अच्छा दोस्त, रात को कुछ भी तकलीफ हुई इसको फोन किया तो हाँ दौड़ता आ जाएगा. एंड व्हाट हैपेंड? लॉस्ट एवरीथिंग. इट इज लाइक गॉड्स ग्रेस के थिंग्स केम बैक. मतलब वो नहीं, कमा लिया, मेहनत करनी पड़ी, बट यस 20 घंटे काम करना पड़ा. आई डोंट वांट कि आप में से किसी को भी ऐसी कोई तकलीफ हो. So that's why I'm telling you all these things, and bit bluntly, pretty bluntly, right? खूब सारी ये इस बार तो इस वीकेंड तो हेट मेल्स बहुत आई है। बहुत आई है। पता नहीं वेदर यू आर, आई मीन सी, आपने जिसने लिखा भी है, I'll take 1 minute and then I'll start with our today's session. वो आप आज का सेशन तो जो लास्ट टाइम का सेशन आपने अटेंड किया है, तो इट विल बी अ प्लेजर, सटा सट जाएगा वेरी फास्ट. बट जस्ट वन थिंग, when you ask this question, are all these things needed? If you feel that it is not needed, so then don't follow. But out of right now, let's say there are 150 people. Out of 150, even एक जना भी ऐसा निकले और जिसने बोला कि हाँ मुझे जरूरत है, I need these things and it has made difference in my life, तो बस this is suffering. What I am telling you is that there is something what is called as the experience. ये सब के लिए मैं बोल रहा हूँ experience, right? Experience is that what do you want to experience in life? If you say yes, मुझे रोल्स रॉयस खरीदनी है, हाँ तो दोस्त बोलना रोल्स रॉयस का एक्सपीरियंस लेना है, खरीदनी है या बैठना है. When I was in Singapore, तो मैंने कहा कि यार बॉस बेंटली में बैठना है. बेंटली में देयर वाज अ टैक्सी, बेंटली टैक्सी. उसने बोला यहाँ से यहाँ होटल तक जाने का $40, मतलब जो $4 में जा सकते थे, $40 में. तो बस तो होने दे, एक बार देखते हैं क्या रख बेंटली में क्या मजा आता है. बैठा है, लगा कि नहीं इसके लिए भी वन शुड नॉट स्पेंड मनी. इट इज दैट सिंबल विच इज मोर इम्पॉर्टेंट. बट इसके ऐसी यूटिलिटी वैल्यू नो. दैट डे आई अंडरस्टूड दैट देयर इज समथिंग व्हाट इज कॉल्ड एज द यूटिलिटी वैल्यू. यूटिलिटी वैल्यू आई हाँ, वो भी मैंने आपका मेल था. आई शो यू माई कैमराज ऑल्सो, ऑल कैमराज, ऑल लेंसेज, राइट. आई शो यू, विल कीप वन डे फॉर दैट ओनली. घर जरा तैयार हो जाने दो. राइट नाउ इट इज लाइक, मतलब आपको डर लगेगा, ऐसा खतरनाक है. लेट इट बी रेडी 10 days. आई टेक यू द एंटायर टूर, पूरा घर देखो, राइट, नो वरीज. बट यस, $40 में मैं समझ गया कि इस कार की कोई वैल्यू नहीं है. इट इज मोर लेस लाइक, हाँ स्मूथ चलती है. तो मुझे कौन सा रोज रोज जो है ऊपर लद्दाख जाना है, अप डाउन करना है. सो ये जो कुछ चीजें हैं, वेदर दैट्स वेयर यू अंडरस्टैंड दैट यूटिलिटी वैल्यू, राइट. दैट इज द गोल, एक्सपीरियंस. देन व्हाट यू वांट टू रियली एक्सपीरियंस, इस ये भी अपना एक सेशन लेंगे. देन व्हाट आर योर गोल्स, or I should you change the word, in order to experience that, what are your efforts? And once you get that, what would you contribute? The third thing is very vital. मतलब when you become, let's say, cardiothoracic surgeon बन, यहाँ पे experience, you want to become cardiothoracic surgeon, ठीक है. What efforts you have to put, you have to study this, that, ये वो, दुनिया भर के एक्स्ट्रा आलतू फालतू सब चीजें छोड़ी. Good, done. What next? Next is, that is when you are at that stage, when you have seen the world, it would be your prime responsibility for the next generation contribute what you have learned in your life. Because why to reinvent the wheel? I mean, there is life का कुछ पता नहीं. आज बात कर रहे हैं, right? The day you become such big surgeons, I might not be there, right? One of my very favorite teachers, no, he is like, I learned the embryology from him, and the way he used to explain that I'm the body of the uterus, this is one fallopian tube, this is second fallopian tube, and these are the ovaries, and then that's how he would be explaining it. The entire embryology, then the things would be imprinted into your brain. You'll visualize as if the things are happening, right? He will say, okay, this is like stomach and stomach rolls. I still, after so many years, I visualize it. He passed away, carcinoma of pancreas. I still remember him, right? Purushottam Rawal. So that sir was to that level. People used to laugh on him. He said, मुझे क्या फर्क पड़ता है? He said that my teacher taught me like this. So that's what he passed on to us, right? So This is what is called as the contribute. So when you have got that thing in mind, okay, what would you contribute? How you will take these things to next level? Suddenly, your experience, okay, I want to learn this. There becomes a reason. There becomes a reason. So this is what I wanted to say in reply to those 4 emails. दूसरा, those गाली तो बोलता हूं, but this is a kind request. ईमेल में गाली मत लिखो, ठीक है? ईमेल में गाली मत लिखो. This is for your betterment. नहीं पसंद तो you can write it in a decent way also. But the few words which you wrote, they are unacceptable, right? I won't be blocking you because I know you are there. I just scrolled and I checked it, right? You are there, but ठीक है, but गाली मत लिख. Don't cross the limit, ठीक है? I won't be blocking you. Acha. This gave me also one more thing. So there are only few people who are emailing me, right? Just I know by on my fingertips. कुछ अच्छा ना लगे तो भी you can say thank you या good या ऐसा लिखने की जरूरत नहीं. बिंदास, मतलब मेरे से गलती हो सकती है. If I'm making a mistake, कहीं मेरे से गलती हो रही है तो do tell me. बिंदास बोलो. Just treat it like as if we are talking one-to-one. So when we are talking about anything, forget about everything else. So it's like, say, for example, Rashina, right? Example. So it's like Rashi, I'm talking to you directly. So then forget about on one side, there is HP, Komlika, Sanyukta, Vikrant, Nafiz, right? Forget about Gajendra, forget about everything. So this is for everyone, as if it is a one-to-one discussion. So that way, even when you'll talk to me on email, कुछ अच्छा नहीं लगा, कुछ लगा कि नहीं मुझे ये चेंज चाहिए या मुझे दिस इज समथिंग विच आई वांट, सो डू राइट. सो ये जो आपने ईमेल भेजा था रेडियोलॉजिस्ट का, यस आई स्टडीड इट वेरी प्रॉपरली एंड इट वाज अ गुड पॉइंट एंड दैट्स व्हाट took me to this, that yes, AI is not a threat. टॉक्सिक पीपल तो पता है कि मैं किसके लिए बात कर रहा हूँ, ठीक है, याद रखना. So here it is. Now we talk about, we just watch the slides, right? That's the purpose for today. So in next 1 hour, right, we'll be watching all the slides. All you need to remember is that in case of epithelium, we discussed about 3 types of epithelium: squamous epithelium, and then there was cuboidal epithelium, and then there was
columnar.
columnar epithelium. And we just remember the shapes, but these are the shapes of the cells. We won't be able to see the shape of the cells every time. We'll be focusing on the nucleus. So here it will be flattened, here it would be rounded, and here it would be elongated. But remember, when it is elongated, right? So it will be near to the
Basal nuclei.
The base. And then there will be ciliated and non-ciliated, and we'll see as it comes, right? So let's start. This is first we talk about, and another thing regarding इनको ना बोला हो तो भी ठक ठक ठक. So simple epithelium, that is when there is one layer, so we'll call it simple. And when there are multiple layers, right, when there are multiple layers, we'll be calling it stratified. Correct? We'll be calling it stratified. And this one would be simple. Uday, okay, approved. So right, so this is the stratified. Stratified means which is in the form of layers. So here
Recording in
is
progress.
an identification process. Single layer of thin flat cells. They are the disc shape. This is what we'll be focusing on. They are dark stained because nuclei, they are seen very clearly dark stained. There is small amount of cytoplasm. Cytoplasm is that surrounding. If this is the cell, this is the nucleus. So then the cytoplasm is something which is surrounding it. So there is small amount of cytoplasm because cell size itself is thick And then the nucleus, so amount of cytoplasm will be very less. It will be more in case of the columnar because nucleus, but the cell is big. Where is it present? Presence is seen at arterioles, arteries. We'll see that, right? Then inner lining of the heart, right? Kidneys, glomeruli, and corpuscles. We'll come to that. Lymphatics, we'll watch it amazingly. And alveoli, we talked about it. That is, in case of alveoli, there is a single layer because that is the layer which will be responsible for the oxygen, carbon dioxide transportation, gas exchange. Correct? Let's see that. Diffusion. So we'll be watching it in the form of 10x, 40x, and then the oil immersion 100x. Same slide, same portion, right? And you'll be able to recognize it instantly. This is a normal arteriole, right? Here is the arteriole. Here are the arteries. This is the entire tissue out of which these are the small arterioles, right? These are all small arterioles, small blood vessels, right? This is a big organ. And we find these arterioles. Let's zoom it further. And as we zoom it, see, you'll be able to recognize that which area has been zoomed, right? It is this area, correct? Right? Here it is. And we are zooming it. So this is what we are watching at 40x. On 40x, if you try to identify the cells, that becomes difficult. But one thing immediately that the cells, they are flat. Cells are flat, where we said that height is less as compared to width. Agreed? Their height is less, but the width is more. They are the disc shapes, right? You can also say disc shaped. These are the disc shaped cells which we are watching. Let's zoom it further, right? Again, this is 40x only. Now another portion of it, right? So this is like we are picking this part, right? We are picking this part. So that portion has been shown over here. Here also, I'll just remove these arrows and you can appreciate that these are all disc-shaped nucleus, right? Now see, this is 100x. Where in 100x, this is oil immersion. So actually, very beautifully, this entire cell is seen. Now, why the cells, they are not seen into, I was expecting this question. And I'll give you the answer. Will AI replace doctors? No, AI will never replace doctors. Bilkul. Why is oil immersion used? Good question. Wait, I'll answer. That's okay. Don't worry. Bronchiectasis. I will talk about that. Brother's report. Yes, I'll reply to it today. There is something which I need to discuss.
Sir,
Like, why are these squamous cells forming a kind of cavity in between them? Like,
Bas. That's what I was. So the question, why there are these cavities? Now see, this is nature, right? If everything is in the form of geometry, so then what happens? There is one cell, there is second cell, there is third cell, fourth cell, fifth cell. And then we slice. So the section is cutting through all the cells. And in that case, we see a very beautiful proper pattern, the way it is given in books. But what if the angle is this? And then we slice. So this cell, it came into that microtome and we are watching it properly over here right now, the cell which we are watching. But the second cell whose nucleus was a bit below and then the section went on the top. Now, when the cell is cut, right? Say, for example, in 3D, if we watch this 3D, this is where the nucleus is there and the section went through this. Now the cell is broken, so cytoplasm, that would be released. So this will be looking as a blank, right? We couldn't see really this nucleus because that nucleus was lower. The section went at a different level. So this is nature. That's the reason that you will never ever be getting the book picture. This is what is called as book picture. When we draw in our histology atlas, we draw it like this. In reality, it never becomes like this. How can it be, right? So that's the reason. See, sometimes we see such a big nucleus. Where is the cytoplasm? वो चला गया. Because exactly it passed through the nucleus, right? In some cases, if it is above, so see over here, there is no nucleus. Over here, there is no nucleus. Over here, we are watching this nucleus. Here, khali khali jagah, right? So the point is this. So whatever the things which we can see, that's what you have to watch. Ki, is the nucleus in general looking flat, 100% flat, 100% flat, flat? Confirm. This is simple squamous because things are not in two layers, multiple layer. It is in one layer. When it will be stratified, that is when it will be in multiple layers, you yourself will see. Right? So this is 100x. Oil immersion is what? For 100x, right? When that lens, if it touches the slide and deeper, right, there has to be an interface between both. For such high magnification, there will be blurring. When you put a drop of oil and then you put the lens, so then that oil will be acting as another lens, right? Because of its refractive index. That refractive index will multiply and it will improve the clarity. So that's the why you have to be very sure, because with that coarse adjustment, you should not even touch it. That fine adjustment and the lens moves in microns up and down. So that's where you get it in sharp focus. Right? Okay, so this is how it is seen. Let's watch the artery. This is gross. This is a full-fledged artery, and this is the bore caliber, right? The blood will be passing through this. What you are watching over here is some leftover blood, right? And we have taken the entire section. We'll be discussing when we'll be talking about the artery specifically, because histology is in two parts. One, today we are learning about different type of cells, right? Then we'll be going, say, for example, cardiovascular system. So then we'll be understanding that how the atria, how the ventricles, right? How they look like, what are the type of muscles, right? That is when we'll be diving deep into it. We'll take the section of aorta, we'll take the section of vena cava, and we'll find that vena cava is such a thin wall, so delicate, and the artery aorta is so robust, right? So this will give you the idea even when you'll be looking it into the CT scan or MRI, right? When you'll just the shape will tell you everything. And it is needed, say, when you see that it should look like this, but when if it is looking like this, and if there is blood over here, now you know this is nothing but it is aneurysm. Where is that aneurysm? From the vertebra. From the vertebra, you'll find that, okay, it is at what level of the body, right? From the branches. So that is where you'll be able, and then you do the angiography and you call the surgeon, cardiothoracic surgeon, that this is the aneurysm, aortic aneurysm, which is at this level to this level, and then he goes for the surgery, right? So this is the importance of histology, because it creates, you'll be able to, medicine is nothing but if you can create the picture in your mind, you are successful, right? So this is a caliber. We zoom it. This is on 40x we are watching. We zoom it further, right? And we go for oil immersion. Now see how it looks like. How it looks like. All those, see, this is a completely different form which we are watching, right? These are all flat cells, correct? देखा? You might say यहाँ पे, these are different cells. These are different cells, right? That will come. What are these cells? What are these cells? Yes, everything will come. All type of connective tissues, and then there are fat globules and everything. Yes, but we are focusing right now on, do we see the squamous cell? Yes, we can see. And it is a simple squamous? Yes, it is a simple squamous, one single layer. Here it is the atrial wall, atria, right? So that's our heart, right? And this is the right atrium and it is the left atrium. This is the atrial wall, which is relatively thin as compared to the ventricles, right? So what are we watching? Well, atrial wall, it is comprising of so many muscles, right? So many muscles, because all of them, they contract. When we are taking a cross section, now we are going into the deeper levels, right? We go deeper, and this is what we see, right? This is what we see, that all the muscle over here, the nucleus, they are all flat nucleus in case of atrial wall, right? In case of atrial wall, surrounding it, this is flat. Diving deep, now talking about the lymphatics. Lymphatics is which are like, they collect all the toxins, and then finally it is dumped into the inferior vena cava, right? And then when it goes into the liver, it gets processed from the spleen. So these are the lymphatic channels, right? Lymphatic channels, let's zoom 10x. Even at 40x, right, it has started showing that, yes, we are dealing with a flat nucleus. But when we zoom it further, no doubt about it, right? It is absolutely single layer, flat, right? So these are lymphatic channels. Moving on to the kidneys.
Sir,
Now,
there are cuboidal too, right?
again,
Cuboidal epitheliums are also seen.
other things are also seen, but right now we just focus on this. Now for the kidneys. In kidney, you know the general outline, right? General outline. This is what is called as the Bowman's capsule, right? In Bowman's capsule, there is afferent vessel, and then there are tuft of capillaries, group of capillaries, and then there is efferent. Efferent is for exit. Now, because the caliber of these arteries, these tuft of capillaries, that is less. So that's why whatever the blood which is going in, right, is under pressure. That's why this entire process is also called as the ultrafiltration, right? Ultrafiltration. That is the filtration under pressure. So in Bowman's capsule, as this blood goes, because of pressure, that water would ooze out along with the electrolytes, right? And then starts the journey, right? There will be proximal convoluted tubule, loop of Henle, and the distal convoluted tubule, and they will be getting collected into the collecting ducts. And all these collecting ducts collectively, finally, they will form what is called as the ureter, right? So we have got the proximal convoluted tubule, loop of Henle, and the distal convoluted tubules, and these are the collecting ducts. So what you are watching over here, this round thing, right? This round thing. See, these are nothing but Bowman's capsule. We are watching this part, right? These are the Bowman's capsule. These are the Bowman's capsule. Bowman's capsule. I'll remove now. I'll just put arrow so that you can watch it properly. Arrow. So let's see. Now we are on 40x, right? We are on 40x and things are like seen much more clarity with much more clarity. So we want to focus on Bowman's capsule. Bowman's capsule, yes, we can watch that it is with all those disc-shaped nucleus. Not clear? Chalo. Now it is on 100x. This is the Bowman's capsule. This one, right? Ye sab kya? We'll come to that. That's it. Right? So this is the Bowman's capsule, this one. And here are our all disc-shaped nuclei. देखो कैसे मस्त एक line में, right? Absolutely fine, one line. Right? So this is on oil immersion. Bowman's capsule is what. Now it is same image, right? Same, the microscope. So we shifted the slide slightly in. And is the full-fledged. Same thing as above. Here it is, right? Here it is. Absolutely flat cells, right? Single layer. So this is what is called as the squamous epithelium, simple squamous epithelium. This particular file, though it has got about 86 pages, right? 86 page, when you'll start scrolling, it will not take even 15 minutes. But for this histology, this particular file, it should be imprinted into your brain. Keep watching whenever you are free, right? Just scroll through this file. Scroll through this file 3-4 times in a day. So within next 3 days, you will never be facing any problem into the histology. First MBBS में तो बिल्कुल नहीं. And when you will start learning the pathology, तब देखना. You will find it a pleasure because the moment these pattern would change, because see what is that? Pathology is changing the pattern. The moment you will find kahan pattern badli, the cell is different, right? It is exactly like music. You don't need to know the rag. Someone is playing sitar, very nice, you are happy. But if he plays a wrong note, कुछ गलत बजाया दिमाग में खटका हुआ कहीं बस कुछ गड़बड़ तो है, कुछ गलत है, बस that कुछ गलत is the pathology, right? When people say कि pathology तो यार बहुत खतरनाक, And pharmacology to badi bewafa, puri raat padi savere safa. This is what we used to say, right? But nahi. Then the Brahma Gyan came. कि pharmacology is purely based on physiology. तब हुआ कि यार गधे फिजियोलॉजी ठीक से पढ़ता तो नहीं प्रॉब्लम होता. Then we went back to physiology के बॉस पढ़ना पड़ेगा. Then the channels opened कि यार pharmac तो is so easy, it's a pleasure. And then when we went into the medicine third year, तब crystal clear, तब then it was like an open sky कि हाँ मतलब वो जैसे पेशेंट खुद ही बोल रहा है कि हाँ symptoms बोल रहे and then it start कि हाँ ये है नहीं है ये है नहीं है. And that was the differential diagnosis. So that's the reason that what we are discussing right now, it is important for that purpose. I want you to take to that level. मतलब आज से 3 साल के बाद या 4 साल के बाद, when you'll be dealing with the patients, live patients, I want you to मतलब दिमाग में ये मतलब AI तो क्या है? You should be much powerful than that. बस. So here it is, right? Apna Bowman's capsule, and these are the flat cells. But meantime, there is some other friend who is also sitting over here, right? Very different type of nuclei, no doubt about it. Matlab this nucleus and this nucleus, they both are totally different, right?
Sir, are they
Cuboidal.
DCT or PCT?
Very good, very good, very good. Shabash. So moving on to this simple, so this was like a recap, right? Simple squamous epithelium, single layer of cells, this shaped, right? This is our keyword. Sorry. This is our keyword, dark stain, small amount of cytoplasm, arterioles, arteries, interlining of the heart, especially atria, because it is thin-walled, right? Because ventricles, things will change a bit. Kidney, glomerulus, corpuscles, lymphatics, alveoli of the lungs, itna yaad raha, to automatically you have understood one thing, that all these areas are such where there is some communication is going on. Kuch liya, kuch diya. Yahan pe gas, yahan pe toxins, yahan pe water, right? Here there are nutrition. So it is when the len-den is, so then there has to be a single layer of cells.
Sir, in lymphatics, fats are also exchanged, right?
But in very small quantity. Very small.
Okay.
On to this is simple cuboidal. Simple cuboidal, we jump on to single layer of cube cells. ठीक है, simple है तो it is single layer, but this is our keyword, large round central nucleus. दिमाग में impression, this is what I am expecting, that I should be able to see बड़ा this big black nucleus round. Then moderate amount of cytoplasm because cell size will increase. Where is it present? Kidney, tubules and collecting duct. Shabash, you already said that, right? तो ये तो पता ही है. Ovary surface and ovarian follicles. This would be very interesting. Something which is normally not seen. I was lucky when I purchased the entire set of those slides, right? Very lucky that I got some amazing slides. It was God's grace. Then parotid duct. Parotid duct is this. There are three ducts that which are making the saliva. One is parotid, second is submandibular, and third is sublingual. Name very easy. Parotid, it is over here. So when you do this, it is your parotid, main duct which is producing the saliva. Mandible is this. So submandibular, which is just underneath the mandible, just behind the mandible. So yahan pe. And sublingual is tongue. So which is just under the tongue, that is sublingual. All these three glands, right? They are totally different. During our secretion process, when we'll be learning the secretion, we'll understand that what are the type of secretions of these three different type of glands. But today we'll be understanding in the light of histology. So parotid gland and the secretory portion. We'll see that. And then secretory glands like sublingual and submandibular, small portion, right? Even that would come. But our main highlight would be kidneys, that is the collecting tubules, ovaries, and the parotid gland. Let's start. This is the kidney, same slide. In fact, it is the same thing, right? And 10x, we move on to the 40x. And the moment we see that, now, this is the Bowman's capsule. And these convoluted tubules, so they are like this, right? And then the loop of Henle, and once again, they are convoluted. Convoluted means steady, made, right? So all this. So like this. So when the section goes like this, so yes, this is cut, this is cut, this is cut, right? Multiple cuts. And because there are so many nephrons, right? This is the entire picture of a nephron. So because there are so many nephrons, so that's why we'll be watching multiple collecting tubules, because multiple slices. सभी काटे हैं कितनी जगह. So Bowman's capsule, right? There are three big Bowman's capsule, but all these, they are the collecting. All these are convoluted tubules, all of them, right? Shape भी अलग है, because say in इसी case में देखो तो this would be the round shape, this would be the round shape, but यहाँ पे जो cut हुआ, it would be elongated, right? So that's why in some of the cases we are watching that elongated. So that cut, it went through that plane, right? So here is it. Let's zoom further. No doubt about it, right? Wonderful. Absolutely, right? This is the proximal convoluted tubule and bada big, proper, round nucleus beyond doubt, beyond doubt, beyond doubt, right? एक नहीं मतलब there are hundreds seen into this.
Sir, there is no distal convoluted tubules.
Hmm. I'll go. Now see this, right? So far, everything clear? Anyone having
Yes,
any
sir.
doubt? All good? Great.
Yes, sir.
Yes, sir.
Which degree is good? Harshavani will talk about it, right? Because we'll deviate, otherwise we'll deviate from the topic. On this Saturday there'll be test. Yes, Gajendra, there is test. आज आज पढ़ लो जो कुछ भी है, right? Saturday को there is test, definitely. All right, on to the ovaries. So this is a section, right? Ovarian or section of ovary.
Sir,
Huh?
watching the previous slide actually.
This one.
Yeah, you were explaining here actually.
This is what I was telling, that this is the cell, right? This is oil immersion. So that is a very classical, literally like as if ke mala jaisa, right? Like a very nice beads. These are like beads. Itna badhiya. And you know, as we'll see the slides, at one point of time, you'll fall in love with the histology. Kya artistic चीजें हैं as you magnify. Okay, this is the ovary surface, a normal tenets, and so many things are seen, but let's zoom it, right? We move on to the 40x, and the moment we move to 40x, see, we'll find that this is the area which we want to see, right? This is the area. As such, the size of the nucleus, we could identify that this is pretty big. Good, let's zoom it. And these are all muscles, right? These are all muscles, these patterns, what we are talking. We'll discuss it when we'll be discussing the ovary, right? But here it is, oil immersion. See, kya badhiya pattern, right? Absolutely single layer. मतलब no one can deny single layer, round, big nucleus. And viva में boss अगर जो ये कोई ऐसा बोले कि this is simple squamous, तो खींच के थप्पड़ मारने का मन हो या ना हो, right?
Yes.
I did that blunder. पता ही नहीं था यार, पता ही नहीं था. मैंने तो देखा, मैंने बोला कि क्या है, उनका सर epithelium. कहते very good. Where is it present? And sir himself said कि बोल दो ना, in human body. Epithelium means what type of epithelium? उन्होंने कहा कि सर squamous epithelium. He said very good, right? Dr. Girish Makar, wonderful sir, right? इतने जोर से बोले पूरे हॉल को सुनाई दिया, right? And then he said बाकी के टीचर्स को, अरे आओ, we have got a potential Nobel Prize winner, right? This is epithelium, right? And it is a squamous epithelium. मुझे कहा अच्छा बेटा बताओ तो squamous epithelium which type, simple or stratified? मैंने कहा इतनी सारी लेयर देख रही है. So let me say something big. मैंने कहा सर stratified squamous epithelium. क्या इज्जत निकाली है तो. Then he said कि come to my chamber, right? Let's stop this histology viva. मुझे literally बोला go and come to my chamber. And there he said कि जा microscope लेके आओ, slides लेके आओ. And then he actually drew and then he explained. मैंने कहा हाँ सर अब समझ आया. तो then he asked कि जब हिस्टोलॉजी का क्लास होता है तब क्यों? तो I honestly said कि सर वो गर्ल्स में खराब इंप्रेशन ना पड़े ना, किसको कुछ नहीं आता. मतलब he laughed so much, but the highest level of respect is what he gave me. When after completion of my MD, right, I was on my bicycle. So sir met me in the hospital. So on the road, he used to drive that Luna. You know Luna? It's a
Yes,
very old
yes.
vehicle, but I think if you know
Yes,
it.
sir.
He used to drive Luna. I was on cycle. He said, "Arey, stop. कहाँ है? मैंने कहा सर MD खत्म। तो कहते रिजल्ट आया? मैंने कहा हाँ सर ठीक है। कहते वेरी गुड। कहते चल नाउ नाउ यू हैव टू पे गुरु दक्षिणा। मैंने कहा हाँ सर बोलो। तो कहते come to the department and he said that you have to teach to this first MBBS students whatever you have learned in this state. I said no problem sir। कहते जॉब नहीं करनी, पहले यहाँ पे पढ़ना। तो ठीक है। Now on that stage, the highest level of respect what he gave was, he said कि ये मेरा सबसे notorious student, right? But I am so proud कि आज इसको मेरे से ज्यादा आता है। मैंने सर के पांव छू, मैंने कहा सर आप ये मत बोलो कभी। But he gave the highest level of respect. And he said कि now you can call me Dr. Girish। मैंने कहा सर मेरा दिमाग खराब है। मैंने कहा मेरा दिमाग खराब है। मैंने कहा it can never be done. But that's the thing. He is still there. So he मतलब इतने खुश होते हैं when I go to his place. अच्छा, right? So this is the simple cuboidal. तो याद रखना, मैं एग्जाम में पूछूं तो कोई बोलना मत स्क्वैमस। सर खूब हंसे थे, कहते हैं सर बड़ी बड़ी सही बात है। मैंने कहा हाँ सर। वापस इन दूसरे टीचर्स को बोला कि कहते हैं वो जो हमारी हिस्टोलॉजी की टीचर थी, तो कहते हैं सी कहते आप ध्यान तो रखा करो कि जब जो पॉइंटर जहां पे है वो खिसक तो नहीं गया। टीचर से यस। कहते हैं अच्छा इसने ऑनेस्टली बोल दिया। मैंने कहा सर मेरा प्रॉब्लम नहीं है, सभी का प्रॉब्लम है। तो कहते हैं कि कैसे पता? मैंने कहा सर हॉस्टल पे डिस्कस करते हैं। कहते हैं ठीक है। नाउ सी दिस इज 100x, राइट? कैन यू से बाय एनी मींस स्ट्रेटिफाइड स्क्वैमस, राइट? अब अपने पे हंसी आती है कि यार दिस इज व्हाट वी यूज्ड टू डू, right? See, this is another view. I'll tell you later on in slightly more detail, right? But say these are the layers, right? These are the surfaces. These are all RBCs, huh? Blood. This is all blood. Because from as per मतलब कहाँ से section लिया है and female is in which stage, then accordingly the sections would come. अच्छा. Now let's see the ovarian follicles. Ovarian follicle again, this thing will be when we'll be discussing the menstrual cycle. That is how that entire process occurs and what really happens to this ovarian follicle and how is it released, right? But in case of females, it is like a fixed number of these cells which are placed into both the ovaries, and every cyclic month, with every cycle, one either from the left or from the right, it is released. Very rarely it is released from both the sides. And during that point, if there is conception, and in case sperms this fertilize both of them, so that is where, sorry, that is where there is twins, right? No doubt.
Dizygotic twins.
That and then the reason of twins, it could be that after the formation of zygote, if they separate and then they both develop, so many reasons, but this could be one of the reasons. But over here, see, you can see these ovarian follicles at various stages of maturity, right? Let's zoom one of it. Let's zoom one of it. As we zoom further, again, look at the border, right? No doubt about it. This is a single layer and it has to be cuboidal because first class, it is absolutely round, right? Absolutely round. Now over here, it might look like a flat one, but majority are big round. So we stamp it as the cuboidal. Here it is. This is a full-fledged, absolutely. This was at 100x. This we digitally zoomed it. This is digitally zoomed, right? So that is where to see the cells with absolute clarity. This is parotid gland. Now this parotid gland, it has got so many components because parotid gland is there. Gland will secrete, and it will put the content into the duct, right? And then the duct would be carrying it. Right, so there is a secretory portion, there is a collective portion. Secretory portion will secrete that saliva, and that thing would go into the collecting duct, and finally all ducts, right? They will collect, and then they will make a final duct, which is called as the parotid duct. Very simple, right? Parotid gland is a secretory portion, parotid duct is a collective portion, and then it goes into the mouth, right? process is not this simple because it is controlled by the nerves. That's the reason when the very tasty thing comes in front of you, right? So automatically means even सोच के भी जो कहते हैं मुंह में पानी आना is what? This is thanks to this parotid, right? So here it is. We zoom, 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 and देखो. This is the secretory portion. क्या cells हैं, right? Such wonderful cell, and this is the duct. This is the duct, and look at the size of these cells. Are perfectly round and single layer. है ना? No way it can be missed. ऐसी slide exam में पूछते तो पता भी चले.
Sir, why are the nucleus so big?
Why the nucleus? They are seen so big because
Mm-hmm.
we are on oil immersion. We are on oil immersion. This is
No, sir,
hemodialysis.
we saw the same cuboidal cells in ovarian follicles, so
Huh, but
there were the nucleus
but
quite small.
but this as such the cell size is bigger. As such the cell size is bigger in case of parotid.
Okay.
And यहाँ पे क्या था? Over here, this
Ball.
is developing. This is still developing, right? It is getting matured. Now, full-fledged ovarian follicle, so there you'll find that even these cells, they are bigger. Even cells, so यहाँ पे भी they are big. But during the section, right? During the section went it in such a way that this entire cytoplasm is almost lost. यहाँ पे चला गया है. Right? So that's why we are literally watching only the cell. As such, the cell would be like this big. It would be this big. This is the cytoplasm. But because the cut went in such a way, the cytoplasm is lost. So that's the reason. Never rely on watching the cellular wall. It is necessary to watch the nucleus. Over here, see, this is seen so beautiful. But over here also, cellular wall is seen only in some of the cases. See, over here it is seen. Right over here it is seen, right? Some portion here it is seen, but mostly we are watching the nucleus, big one. This is sublingual gland. It's sublingual underneath the tongue. Over here, as we zoom, right, and see over here, we are watching this big nucleus. See, this is the duct, right? This is the duct. And over here, it's a sort of mix. Some of them, they look like cuboidal, but mostly they are like
Columnar like them.
columnar, right? Columnar. See, long elongated nuclei. So that is our next topic.
Sir,
Huh?
is there a slide for pseudo-stratified? Because I'm getting a bit mixed here.
Pseudo-stratified, say it will occur in bladder. Why we are not telling this as pseudo-stratified? Because these glands, they won't be stretching too much, right? So this is the standard picture which you watch. So as such, so in fact, this should not be shown over here. It has to be shown into this columnar, right? So just keep it in the columnar only. This is classical columnar. Some of the cells, some of the basal cells, right? They are seen in the form of those cuboidal. Achha. So collecting duct, now collecting duct, right? Collecting duct.
Will you please once explain the characteristics of pseudo-stratified?
It will come, right? Just in a minute, in 2-3 minutes, it will come. Pseudo means false, right? Pseudo means false. So false is like when the cells, they are like arranged, but they look like as if they are into multiple layers, but as said, they are into one layer, right? Like what Sapna said is very right over here. Say they look like that as if they are in multiple layers, but no, they are as such single layer, but they look like as if they are on multiple layers. You'll find that in bladder, urinary bladder, right? Which is transitional, right? That is when in stretch state, they will be like flattened. Otherwise, they will be like, right? The nucleus will be rounded and over here it will be flattened. Transitional. So structures which can really stretch, so they will be showing this pattern. But many of the structures, they will be showing it this pattern. So here, pseudo means visually it looks like as if they are multiple layers. But as such, if you draw a line, so all of them, they are connected to the base, right? Pseudo means false appearance. Now, this is like a classical pattern. See, as we take the section, we see that these are all the collecting ducts, right? See the collecting ducts, all collecting ducts. Clearly, right? These are all round nucleus. And over here, you can see the whole cell very properly, right? Very nicely, you can see the whole cell. You see, so many cells, they are seen fully, along with the entire wall, cytoplasm, everything, so many, right? Over here, here, here. Right? So that's a simple cuboidal epithelium, single layer of cube, shaped and large round nuclei, dark stain. So that was the type of nucleus. On to the next one. Non-ciliated, simple columnar. Now it is like, this is columnar. In columnar, we expect the nucleus to be elongated, but then we have got the two options, two types of option. One, when there would be the cilia over here, and second, in which case there won't be any cilia, right? So these cilias, they'll be not present. So this is what we call it non-ciliated, and this one we'll be calling it ciliated, right? So our first one is non-ciliated, so that we don't expect anything to grow out of the apex of the cell. So this will be having round or oval shaped basal nuclei, right? Large amount of cytoplasm, even if it is round, but say its shape would be like round, so okay. But the amount of cytoplasm, that would be substantial, right? We'll be able to see. And there would be presence of goblet cells. Goblet cells, these will be the round, perfectly round cells. And these goblet cells, they will be appearing as a blank spaces. So they are the unicellular glands which are for secretion, and we'll be able to see that. Where do we see it? Digestive tract, right? It lines digestive tract all the way from stomach to anal canal. Only when it will come to intestine, we'll watch microvilli. Microvilli is something which increases the surface area, right? So we'll see the intestine. I'll show you. Then gallbladder. Function of gallbladder is two. One, store the bile, and second, it makes the bile concentrated by 50 times, 50x concentration. So that's the purpose of the gallbladder, because gallbladder will keep on storing the bile till you eat butter. When you eat butter, immediately reflux will come, it will contract, that bile would travel all the way to the common bile duct, right, onto the cystic duct, and then it will open into the ampulla of Vater to the second part of duodenum, right? So that's the duodenum.
Sir,
That's
butter or any type of fat?
any type. Butter is just an example.
Okay.
Yaad rahe na
Okay.
isliye.
Okay.
Right? So that is the ampulla of Vater. That is the point where the pancreatic duct will also come, because pancreas is present into the C loop of duodenum, right? So this is the first part, this is the second part, this is the third part, and fourth part is retroperitoneal. That means it goes back. Now, when I say retroperitoneal, that means this is the first part, this is the second part, this is the third part, but the fourth part would go back, right? So it is retroperitoneal, and this is called as ampulla. Ampulla means opening. Ampulla of Vater, V-A-T-E-R, ampulla of Vater. That is into the second part. That's where it opens. Then uterus, some portion, and the excretory duct of some glands. So let's see that. We start with duodenum. Right? Here is the duodenum.
In simple columnar epithelium, we won't have to look at the nucleus for identification. We can just directly identify it from the morphology, right?
You identify from the?
Morphology, like the shape.
From the shape. But when you will see the nucleus now, you'll be crystal clear, right? See, even when it is shown like this, even at 10x, instantly you say that this is from digestive system, because such tortuosities, right? It is seen only into the digestive system. So this is fine. We just zoom it to 40x. Right now, no doubt about it. Classical, beautiful pattern, right? All elongated nuclei, right? And when we zoom it, if there is any doubt, wonderful, right? Here it is. This is the base, and then this is our nuclei, all long, elongated, right? And there is so much of cytoplasm, and at the same time over here, there is no cilia, because if there is cilia, then we'll be able to watch it like this, right? In this case, there is no cilia, so we are not drawing it, right? This is the lumen. This is for your reference, right? So how the section is taken? So section is, right? Say, for example, I'm drawing it like this. Say it is like this. And let's say, wait. Let's say this is the loop. This is the loop. And the section is like this. So we watch this, right? So that's why it is looking like this. The lumen is inside, right? So this is the lumen. This is the lumen. So it is thrown into several folds. So that is to increase the surface area, right? Gastric tube is not like a straight tube. It is thrown into folds. So this is the lumen, and these are the cells, right? Classically, all cells, anywhere you see, right, they all will be seen like this. यहाँ पे don't confuse, because it is like, because of the curvature, the cells, they got cut at a different angle. Got it? They got cut, but again, as it came, see all this. Over here, again, there is a turn. So that's why cell to ऐसा ही था, nucleus was also like that, but it got cut like this. So that's why it is showing like this, right? But you have to look at, very rightly, you said, only the morphology and the overall pattern, so that it tells you what it is. Here it is on 100x, right? A classical, beautiful pattern, right? No doubt about it. On to the stomach. This is the cardiac end. Cardiac end means it is this is the esophagus. This is the esophagus, and that's the cardiac end. This end is called as the pyloric end, right? We are dealing with this part. So it is the cardiac end, that is the end where there is a junction of esophagus and the stomach, right? Let's zoom this further. Let's zoom this further and see how the things really look like, right? Over here, this is the better one. Now over here, you might be tempted to say that this is cuboidal, but look at the cytoplasm. This is the whole cell. This is the whole cell. This is the whole cell.
Basin.
Right? Look at the amount of cytoplasm. Cytoplasm is so much, right? This is the whole cell, big one. So this nucleus that is at the base, there is so much of cytoplasm. So that tells that yes, we are dealing with
Columnar.
Columnar epithelium.
yes. On to the gallbladder. Gallbladder to dekhte, instantly you know, right? Here it is. I don't have to even explain. We move it further and zoom, and here it is. So amazing, right? Look at the size of the cell, huge ones, right? But then that's the nucleus. So now you know, when we emphasized on that, we'll always be watching the nucleus, right? How easy it becomes to identify such big cell, right? But nucleus, basal, so much of cytoplasm, no doubt it. This is, we are dealing with the columnar, right? Intestines, zoom, and wonderful. Becoming more and more clear, right? Such a discipline, long cell, but then this is basal, right? It cannot be anything else. All of them, they are into single line. So simple square, a simple columnar epithelium, right? No doubt it.
Non-secreted.
Let's move further. Here it is, right? This is 100x. We remove this. Right? You know it. Right? This is the basal layer, right? And this nucleus, this is basal, and that's the entire cell. Right? And that's over here. This is the lumen. On to the uterus, right? So a section, these are the uterine fibers and the uterine muscles, or all uterine muscles, but we want to just see the cavity. And over here, Now, even in uterus, depending upon in which phase, right? If whether it is into the estrogen phase or it is into the progesterone phase, right? So this structure of the uterus, I mean the histology of the uterus, it keep on changing slightly, but this is what you will definitely see. You will appreciate that, okay, these are the cells. These are the nuclei which are elongated at the base and varying amount of cytoplasm, right? Varying amount, but it is sufficient cytoplasm to stamp it as simple columnar, right? Now this is mucin secreting salivary glands. So there are water secreting salivary glands and then there are mucin secreting. Mucin means it is the mucus secretion, which is a thick secretion, right? So this is a normal 10x. We move on to 40x. In 40x also, it is now clearly evident. And as we zoom further, right, we get the idea, because over here we can watch even the cellular wall, right? Cellular walls, they can also be seen, but very simple. Back to our gold standard that we want to watch the nucleus, and is the nucleus connected to the base? Yes. And is it elongated? Yes. And is there any cilia? No. So that's why this is a non-ciliated, simple columnar epithelium done. Right. In an exam, you'll be asked like this only, that what type of epithelium it is, and then it will go into the theory.
सर
हाँ.
सर यहाँ पे बोला है कि एक्चुअली म्यूकस रहेगा तो सिलिएटेड भी रहना चाहिए.
Not necessary, not necessary. Cilia is to increase the surface area. Right? It'll come. When it will come, you'll be able to see it crisply. वो intestines में आएगा. Right? This is the secretory gland. Its function is to secrete. It has got no role in increasing the surface area. Why you want to increase the surface area? The brain is thrown into folds to increase the surface area so that every surface it can really work, right? Over here, for the cell, when we'll be discussing about the secretion, so in some of the cells, so they just release the fluid. In some of the cases, this apex is broken and it is put into the lumen. Yeah, there are various type of apocrine, etc. There are various type of secretions which we'll study. But over here, this is a mucin secretion. So straight away, these cells will secrete.
There
Now
might
we
be
want
this
to-
transport of mucus also, no, sir?
Right. So this was a recap. On to the ciliated simple columnar. Now we really want to focus on this. There is presence of cilia. Where will it be? Small bronchi, uterine tubes, uterus, some portion. Right. These cilia are important, right? What was the name of the syndrome which was associated with it?
Carragher syndrome.
Cartagena, right?
Cartagena, sorry.
Cartagena syndrome.
Cartagena.
So let's see that. Now this is bronchi, okay? Bronchi, as it is cut, right? And now we see, no doubt about it, right? Wonderful cilia. See?
Yes, sir.
So prominent. And still, let's move further. Here it is, right? Here it is. So all these cells, they are elongated, but what we are watching is the cilia. So these are the cilia. On to the fallopian tubes.
Sir, we can also see stratified cells, right?
Not
on
all.
the previous
Not all.
slide.
Yes. Not all of them are stratified, right? But mostly are stratified, because when you'll watch the layers, right? When you watch the stratified, you'll say, this is simple. This is barabar. This is true.
This was stratified, right?
No, this is
slide?
simple only. This is simple only, but the cells, they are cut at various levels.
Okay.
Right? I'll show you the stratified. So fallopian tube, that's the fallopian tube, right? And because inside also it is like tortuous and it has got those villi and they have got those cilia, right? It will lead to transport, right? And here it is, right? Here it is. See, you can watch these cilia, right? Here it is. See, right? And they are irregular, obviously. Right? Over here also, see, this is simple, right? This is simple columnar. So this is one, Though this looks like this is one cell and this is another nucleus, possible because they might be slightly overlap. See, it's single layer, it is not like this single layer, right? Single layer is इसके बाजू में भी तो दूसरा tissue है, right? So if I watch from the top, right, this is the top view. So one cell, second cell, third cell, fourth cell, fifth cell, sixth cell, this, right? All of them, they are arranged like this, right? So when we watch from the side, it is possible that the nucleus of this and the nucleus of this, they are overlapping. That's what is seen over here in the form of overlapping nucleus. But all these cells, they are connected to the same basement membrane. Right, the recap. So that's it. This is for the simple columnar. Regarding this stratified and everything, right? We'll have another session when we'll be at that point we'll be discussing it along with all the other structures, right? We'll be taking hepatocellular system also and even rest of the organs of the body. But saved. So do revise this thing properly, right? And we meet on Saturday. And wish you all the best for your exam. Right? Do good, do best. Yes, anyone wants to ask anything?
Sir,
Sir, I wanted to ask that have you posted 26th August session on YouTube because it's not there. Only 23rd August there. Sir.
I mean, can you name the topic? Which topic?
Sir, I was absent during that topic, so I don't know.
Histology basics, sir.
Histology, it is there. Definitely it is there. Histology topic? So it is
Yes,
there.
sir.
yes, sir, it
It
is
is
there.
there.
Yesterday I saw it, sir, but it wasn't there.
No. You go to channel and you go to the general anatomy, and in general anatomy, it second last would be there. You just scroll down, it is there. In case if you don't find it, just send a mail to me. I'll send you the link.
Okay, sir.
In
Thank
case
you.
if you don't get it, it is but definitely there.
Sir, I wanted, sir, I messaged you about which degree is good.
Which degree?
Yeah, because there are so many people telling me that other than MBBS, this is good, that is good. Why don't you do this?
See, this MBBS and then homeopathy, then Ayurvedic medicine, right? All those things what you have written, BAMS, etc.
Yes, sir. Yes, sir.
See, the toughest is MBBS, right? And then in MBBS, after MBBS, you have to go for post-graduation, after that super specialty. So जिंदगी के 12-15 साल गिन लो. At least 10 years. If you just do MBBS internship and then the post-graduation, at least 10 years. It's a long journey. Not everyone can do it, right? But it is equally rewarding. Say it happens like, I don't know the reason, but wherever I meet any of the Ayurvedic or homeopathic doctor, so they are to matlab jaise, the moment you say that you are allopathy doctor, right? So बस सीधा उनको गुस्सा आने लगता है. They say कि नहीं, your medicines, they have got the side effect and this and that and everything. And when they say that no, homeopathy has got no side effects, Ayurveda has got no side effects, totally agree. Ayurveda is very good. I have tremendous.
But they don't even have effects fast enough.
It happens like, say, Ayurveda is the way of life. Means when you are healthy, fine, wo adrak piyo, ye piyo, haldi piyo, all those things, they are super fantastic. Even I drink it. But in case if there is any tumor, then that thing won't treat. It is at that point when you need to go for CT scan, you need to go for MRI, you need to go for exploratory surgeries, you need to go for angiography. वो जरूरी है. So MBBS is like a gold standard regarding all these things. Say for example, ये physiotherapy कहते हैं, right? If you have done MBBS properly now, जितनी भी degrees आपने लिखी ना, you'll be knowing about all of them. And you'll be able to understand them thing in no time. मतलब कोई आयुर्वेद वाला भी कुछ बोलेगा, you'll be able to understand it very fast. So if we follow that principle that go for the best, go for something which is at a highest level. Matlab race ho, so there is a 10-kilometer race, 21-kilometer race, 42-kilometer race, and then there is 50-kilometer race. Always opt for something which is highest, something highest. So that's why it is said that opt for the best, even if you are not successful, but you'll be achieving much more than others. You'll not be stopping at 10, right? Because your aim is 50, at least 45 to karenge. Still, you are better than so many people.
That's what I'm trying to tell to my friends and family members, that you should take higher degree. Why should we opt for lower
Don't
degree?
listen to anyone. Don't listen, Shavani. Don't listen to anyone. This is the
Yes,
point
sir.
when you have to take that step. And कई बार एक मैं बोलूं, लोग कहते हैं, मतलब there was नहीं है कि क्या मेरे लिए तू इतना नहीं छोड़ सकती, right? What is that? You know, that sacrifice is nothing but they consider that your growth is a sign of betrayal. कि धोखा दिया, मतलब क्या, मतलब people they say कि तू एडमिशन ले रही है वहां पे जॉर्जिया में, तूने धोखा दिया. It is not dhokha, because they cannot digest your growth. So people consider your growth.
They think they can't control you
Because
anymore.
they can't. They take it, and this is what is called as gaslighting. This is emotional torture. So जब कोई बोले ना, अरे ये भी अच्छा है, वो भी अच्छा है, simple line means we don't have to say अपना दिमाग नहीं खराब करना. Simple line, shoes बाहर उतार के आओ. Exactly that way, there has to be the emotional boundary. Don't let any of those crap spoil your mind. Just say, मुझे पता है क्या करना है. Everything is good in this world, but मुझे पता है मुझे क्या करना है, and I'm doing that. Meet me after 10 years. I'll show what I can, what I can do and what I did. Bas. Because people watch finished product. किसी को नहीं लगेगा the day you will become MBBS, right? अरे वाह डॉक्टर साहब, right? Suddenly everything would change. Right? अभी तक गजेंद्र बुरा मत मानना, मतलब अभी जैसे किसी को बोला अरे गजू इधर आना, राइट? बट देन डॉक्टर गजेंद्र मोरे, right? Immediately things would change. You go to post graduation and still the level would change, because now then everyone would be proud of के पता है वो डॉक्टर गजेंद्र है ना, वो मैं उनको जानता हूँ. That would be the impression. और अभी ऐसे बुलाएंगे because they don't like it कि आप आगे बढ़ो, and पता भी नहीं चलता कि when people are having
Crab mentality.
malicious intention. उसका अपना लड़का या लड़की को नहीं मिला एडमिशन, नहीं जा रहा, नहीं पढ़ रहा, so it is, खूब ऐसी सब चीजें चलती है. How do they cut with such precision on a cellular level? नहीं प्रीतम, कुछ नहीं होता. Say for example, this is ovary. This is ovary. So it is called as the microtome. Microtome. Now at this point, you know, tome means, Tommy means kutta nahi, but Tommy means to cut.
To cut.
Micro means very fine. So this entire thing is freezed into wax, right? It is put into wax, and then वो block बनाते हैं, right? It is like a cube which is made. Now in that entire ovary is there, and then it is mounted, and then a very fine grade chak, right? जैसे वो potato chips बनाते हैं, right? Very crude comparison, but same way इसकी chips पड़ती है, right? And then that chip, it is mounted on, then it is stained by H&E stain, hematoxylin and eosin stain, and then it is mounted on the slide. उसके बाद glass chip रख के, and then it is sealed, and then you see it under the microscope, right? It is called as a microtome.
Okay, sir. Thank you.
Sir,
हाँ.
sir, in immotile cilia syndrome, will the structure be similar or slightly different?
Structure would be different, because when the, I mean, histologically, there would be very less difference.
Yeah, sir. Then
You
how will we observe?
might, because it is like when in the real live person they move, right? यहाँ पे तो person बेचारा है ही नहीं, वो तो dead ही है. Would you please share your email since I don't have it? Okay, Shamika, just a minute. I'll write it here. It is, email address is very simple. It is TILLUR mbbs@gmail. Right? It is still mbbs@gmail.com. सिलेबस ऑफ द एग्जाम ऐसा कुछ नहीं, आज तक अभी तक जो कुछ भी पढ़ा दैट विल बी द पार्ट ऑफ एग्जाम, राइट अनुराधा? ओके,
Recording stopped.
Vansh, I want to know what psychiatry is good. Psychiatry is definitely good, but say even for psychiatry, you'll definitely be hired into any of the hospital. No. In hospitals there is psychiatry unit. In civil hospital, so that psychiatry unit is amazing. Every day you learn so much. ऐसे पेशेंट। अच्छा, योर फ्रेंड कॉल यू गज्जू? अच्छा चलो तो ठीक है, मैंने भी ठीक ही बोला तो। यश, in case of pseudo, it can look both. It can look elongated, it can look round, both. Thanks, Anwar.
Sir,
All right, huh? Yes, Kunjal,
sir,
go ahead.
why were there gaps between the columnar cells in the uterus?
हाँ, वो गैप मैंने इसलिए बोला कि say all those gaps, right? Say when during the menstrual cycle, right, during the bleeding phase, uterus starts preparing itself that yes, if there is any conception, so then that fertilized ovum would come and it has to embed into the wall of the uterus for the development of the fetus. If there is no fertilization, so then entire wall which was prepared, which was having rich blood supply, which was having so many tissues, it starts breaking, and during the bleeding phase, that entire substance that is shed off. So now the uterine lining, right, that endometrium, that is clear. But depending upon on what phase that female died, and the uterus was at that what stage, and then the section is taken. So that's why, depending upon the breakage of that wall, you see all those gaps. Right? Because uterus is a highly dynamic tissue, highly dynamic organ. Means every day there is some change, whether it is in which cycle. Means up to the day of 14th day, right? It keeps on developing, because that is the point when the ovulation would occur. So that is when the estrogen levels will also rise. We'll discuss it in detail, right? But in general, when the estrogen levels would rise. So by the 14th day, by 14th, 15th, 16th day, that is when the ovulation occurs, female will be in fantastic mood because the estrogen is highly stimulatory hormone. But then starts the decline. It is at that point when the progesterone will also start rising, with the expectation that yes, it has to embed. But by the 25th day, when there is no embellishment, so then sudden drop of the hormones, and then the entire line is shed. So it is during that phase, that is just before her menstrual period, many times when it is said that female becomes irritable. Why? It is not their fault. It is because of the sudden drop in the sex hormones, right? These hormones. So that leads to irritable nature. That's why in menopause, when those hormones, they have gone down to a very, very dangerous levels, right? Females, they won't feel good at all, right? There'll be hot flushes, they'll be highly irritable, they'll be a bit forgetful, everything happens. So that's why it is like a combination. Males, they don't understand it because the testosterone levels, they don't drop it drastically. But if they drop, right, you'll know immediately. Because the entire energy level will drop like anything. And that's what my intention was, those two lectures, right? Those two sessions. But we'll not be breaking our current teaching cycle, right? So Tuesday, Thursday, Saturday, they are the fixed. We'll not be discussing, we'll not be taking any of the extra lectures during this time. But then you let me know. Let's say if you want it on Sunday, so we'll set a time. You want it on, let's say, Monday, because Monday we are not meeting, right? But Monday, by our mutual understanding, if we wish, we can meet and we can have any of those topics, right? Just let me know and accordingly we'll set it. Last two, the टेस्ट के अंदर ऋग्वेद बहुत टेंशन मत रखो, whatever the questions which comes, answer it. अब तक जो पढ़ाई की, that would be the there. Ashraf, same answer. Same answer. Whatever we have discussed till today, that will be part of the test. And questions would be very simple. Most probably, I won't be giving you MCQs. I don't like MCQs because MCQs में क्या वो गप्पा मारने का चांस मिलता है, randomly दे दिया कि B, option B, right? So 25% chances तो है ही ना correct होने के. So that I don't know. You should really know the subject. So that's why at times I say you fill in the blank, you write it, you give the diagnosis, okay, what it is. Okay. So again, इस बार भी last time जैसे रखेंगे. Thank you, Yash. Marian, you are funny. Mom slaps you because of that? Well. Mom slap because of some good reasons also.
You know the reason, sir.
All right. So thank you so much.
Thank you, sir.
Love you
Thank
all.
you, sir. Bye,
Thank
sir.
you, sir.
Thank you, sir.
Thank you, sir.
Thank you.
Thank you, sir.
Bye bye.
Thank you, sir. Bye, sir.